Welcome to another episode of the Local View Health and Wellness. I'm your host, Kristen Owens, along with my beautiful co-hosts, Lorraine and Alicia. And today we have an eye doctor in the studio, Dr. Maharaj. Did I say that right? Okay,
That's
good.
right.
And so how are you doing?
I'm good. I'm great. How are you?
I'm very good. Thank you for being here.
Oh, thank you for having me.
So you are an optometrist.
Correct.
And so you are all about eyes.
That's it.
Everything okay? So tell us about eye health. Why is it important? And why is it important? Because I will say I've never been to an eye doctor.
Ever?
Never.
Never.
Have you been?
Wow. So this doesn't count.
Recently.
First of all, you still have to come in and see me.
Okay.
But I mean, we have two of them. We only get two.
Okay.
And vision. I mean, I think most would agree that vision is a pretty precious sense.
Yes.
And so throughout the course of our lives, our eyes are subjected to a lot of environmental stress, a lot of health-related stresses, physical ailments, and so our eyes are actually kind of the window to our body, and there's a lot that we can see before diseases pop up through the eyes. So coming in for your regular annual checkups is really important for that reason and that reason alone.
Okay,
let alone others.
So what can you see? What can
we can identify things like diabetes before it actually shows up systemically.
How would that show in an eye?
We'll sometimes see cataracts. We can actually, unfortunately, sometimes we have bleeding inside the eye, in the back of the eye. And the thing is, in many cases, there's no symptoms that go along with these early presentations. So that's, again, one of the reasons thyroid eye disease can show up, so thyroid conditions can show up.
Is that, again, from bleeding in the eye? Or?
Thyroid would show up a little bit differently. It can show up in terms of the way that the glands function or the way that the eyes move together. Sometimes the nerves can become swollen inside the eye. So
it's something that we couldn't see just by looking at our own eye. We would have to come to you?
80% of the things that actually show up are asymptomatic and undetectable just by day-to-day occurrences.
I have a question. Do you see a lot of cases of strain in the eye? Because we're always looking at these PCs and these little phones, and we're on it all day now, on computers all day.
Absolutely. I mean, that's probably the I'd say one of the largest things that I see in my clinic, because I deal with specifically a dry eye population. A lot of my patients are dry eye patients. And so you're absolutely right. You're staring into a screen all day long, whether it's a small one or a big one. And what actually happens is our blink rate reduces, right? We're supposed to blink once every 7 to 10 seconds. Now you're going to think about it. But during computer work, our blink rate can actually drop to once every few minutes.
Really?
Oh.
Yeah.
That's very
And the thing about that is when you're not blinking properly, there's little glands, and we talked about this earlier, in our eyelids, and when you blink, those glands actually get squeezed. So when you're not blinking, those glands don't get squeezed, and if you don't use it, you lose it. So the glands actually start to die, which is what causes dryness and further development of that disease.
So just make sure, guys, make sure when you're on your devices, blink. And
just keep blinking away. You could look away. You don't have to stare.
There's actually
unless you're watching us.
there's a rule that we give our patients. It's called the 20-20-20 rule. Every 20 minutes, look 20 feet away, blink 20 times, just kind of refresh. Right, and so that kind of gets the glands moving.
I'll add exercise to that. You just get up every 20 minutes and blink as you walk.
And squat.
There you go. Blink and squat. A lot of movement
we should
right
do a segment on that.
Oh gosh, at the office that would look a little strange. It would.
But strange is good.
Yes.
Good.
So where are you located?
I'm at here, Ontario and Steele, so I'm just on the south end of Brampton.
Okay.
At the corner of here, Ontario and Steele.
Okay.
The clinic is called iLabs Optometry, and we've been operating there since 2012. And so we're a specialized clinic because I do see a lot of dry eye patients, so that is my subspecialty.
Dry. When you say dry?
Dry eye.
Dry eye.
So dry eye is actually a disease, it's a condition.
Oh.
Yeah. And so
that's just because they're not creating the liquid in your eyes from the duct thing?
One of the reasons, yeah. So there's a multitude of reasons, but that is one of them. So I really hone in on the tear film. So your doctor would do, blood testing to determine if you have these things done. I'll do tear testing, right, to see what kind of chemistry is in the tear film and things like that. So it's interesting, at least to me.
Yeah, so you were saying at least once a year. What about for children? How soon should they see an eye doctor?
Wonderful question. So October was Children's Vision Month. So the Canadian Association of Optometry has put forth sort of an agenda to kind of make sure parents are educated. Earliest eye exam should actually happen between 6 and 9 months old. So that might seem a little young.
What do you use? Like, how do you tell with a 6-month-old that they can see or they can't see?
Yeah, I rely on them to tell me everything. No, I'm just kidding. But, there's actually quite a few tests that we can do that rely purely on observation.
Okay.
Certain lights that I can use to shine into the baby's eyes and look at the reflex back. So there are several things that we can do to get a good sense of the overall ocular health, to make sure that there's nothing sinister happening at an early age. Unfortunately, there are a few very devastating conditions that can show up in that age group. Something called retinoblastoma, which is an eye cancer, which is detectable at that age. And the sooner you can identify that and treat it, the less likely, more fortunately, that child will survive and live.
Yes.
And a quick story: I had a friend who lives in Dubai at this point, but she sent me a picture of her son, who was just 6 months old actually at the time. And from that picture, the flash, the reflex in the child's eyes, I was able to determine that this child actually had a tumor.
Really?
And got them over to sick kids, and thankfully this child is alive and well.
So
she had the eye nucleus.
Was it just because there was a reflection, or what were you seeing?
So if you've ever taken a picture, if you've taken a picture of your cat, you'll see that reflex that shows up.
Yeah.
So if the reflex is symmetrical, it looks the same color, the same brightness, and that's normal. But when you see a difference in the reflex, if one color looks dark or white or just absent altogether, that's an indication that there may be something awry. It doesn't necessarily mean it's a tumor, but it's definitely a reason. If you're seeing that at home in the pictures of your kids, or if you're just seeing that looking at them, then you want to make sure you visit a doctor of optometry.
Yes.
Have that assessed.
I know, now I'm staring at everybody's eyes, I'm blinking.
Well, I know there's a link with
this
academics with children because, if your child's not doing well in school, they always say rule out the physical before you do the intellectual. And it could be just that they're not seeing well. They're not seeing the board, they're not seeing, and then you're thinking, well, you need more tutoring, and they really can't see, right?
It's so very true. I mean, 80% of our learning comes from our vision.
Yes.
So it begs the question, if something is happening whereby your child is having difficulty in school, well, certainly have these two little peepers checked. And so I didn't finish, but 6 months old is the first assessment. Then by the age of 2 to 3, another assessment should be done. And then once school age hits, every single year. So in the province of Ontario, children are covered for their eye exams every single year, once a year, and then for emergency visits as well. So if there's a red eye or an itchy eye, etc., they'll be covered for that. But definitely a comprehensive exam once a year to rule those things out. And there are very, very strong ties between learning difficulties and vision. In fact, 60% of children with a learning problem actually has an undiagnosed visual problem.
Yes.
Wow.
1 in 4 kids in total actually have an undiagnosed or a diagnosed vision issue. So, it makes sense that we start to look at these things in a little bit more.
Well, we think about the dental, like we don't forget about that, go to see the dentist regularly, but we don't think about the eye being an annual. We think of our physical checkup, but we don't think about the eyes being part of that either, right?
And also, I mean, that's because usually during your physical, the doctor will have you look at the big E at the end of the room, and that's sort of that's the test that I guess, you're all expecting to get. That's your vision test, but there is far more that needs to be looked at, and we're in the 21st century. Our ability to see things inside the eye, our diagnostic abilities, our equipment that we use, and just in general, our skill set is far broader than it ever was. And we're actually working with health professionals now. I mean, I work closely with rheumatologists, with family physicians, other specialists, so now we can actually, like I said, the eyes are the window to the body, and so now we have more of a collaborative model, or at least we're trying to engage in a more collaborative model of healthcare,
That's good. Yeah. Wow, so I know also my oldest daughter has, she needs reading glasses, so when she looks at the board, it's kind of blurry, and then when so the doctor has given her a prescription for a very low prescription,
right?
Just for reading. So it's like one of those glasses where, like the grandmother ones, where you're reading. You can look up like, maybe it's when she's reading a book. So many times she'll be like, I remember walking into her room and she's like, this. I'm like, Ayana, what are you doing? She goes, this is what I've been trying to tell you. And she's reading like this. I'm like, it was the funniest looking thing. So he says glasses for close, and then you look up to the board and you can just see
pure over the top.
Yes.
So it makes her look about 10 years older, so she's always angry at you.
She might like that at her age, right? She's probably like, I look at this is wonderful.
So, that's a perfect example. I mean, here's a quick analogy. Think about your eyes being like a bicycle, and imagine trying to teach...
1 minute.
a child had to ride a bicycle that has, a weak muscle in one leg and a longer leg on the other. The coordination is incredible. It's amazing that we're even able to do it. So again, going back to difficulty with reading and learning, it makes perfect sense to have all of those systems in check. And there are 9 muscles around each eye, not including the ones that you use to focus. So there's a lot of coordination that has to take place.
Huge coordination. So he says, get the glasses doesn't mean she'll always need them, ever? No. Okay, so it can change, right?
Absolutely. Absolutely.
So if someone wanted to find you, where would they find you?
So our website is www.eyelabs.ca.
Okay.
And our phone number is 905-456-9333. And we're at here in Ontario in Steeles.
Excellent.
iLabs is the name of our clinic. So
excellent. Yeah. Wonderful. Thank you so much for being here. That was great.
Thank you for having me.
Thank you guys for listening, and we will be right back after the short break.